Theories of personality and assessment. Definition of personality. Personality refers to the relatively enduring characteristics that differentiate one person from another and that lead people to act in a consistent and predictable manner, both in different situations and over extended periods of time. Personality is defined as the enduring or lasting patterns of behavior and thought across time and situation. Personality. There are four major perspectives on personality. These are psychoanalytic, trait, humanistic, and social cognitive. Unconscious psychoanalytic is based on unconscious motivations. Trait is based on specific dimensions of personality. Humanistic is inner capacity for growth, and social cognitive influence of environment. Sigmund Freud. Sigmund Freud uh, he is specialized in nervous disorders. Some patient disorders had no physical cause. Sigmund Freud. Sigmund Freud stated that what is the structure and development of personality according to Sigmund Freud and his successors, according to psychoanalysis. A psychoanalyst, much of behavior is caused by parts of personality which are found in the unconscious and of which we are unaware. Freud's three levels of awareness of consciousness: the conscious mind, the pre-conscious mind, and the unconscious. Psychoanalysis, the unconscious. Conscious awareness is the small part above the surface, and unconscious is below the surface. Thoughts, feelings, wishes, and memories. Okay. And repression is banishing unacceptable thoughts and passion to unconscious dreams and sleeps. Psychoanalysis, Freud's theory of personality. Three levels of consciousness: conscious, things focusing on; pre-conscious, things currently but focus on; unconscious, that unaware of. Freud's theory of personality. Freud's theory suggests that personality is composed of the id, ego, and the superego. Id, the unorganized, inborn part of personality whose purpose is to immediately reduce tensions relating to hunger, sex, aggression, and other primitive impulses. Ego is restrains instinctual energy in order to maintain the safety of the individual and to help the person to be a member of society. Superego, the rights and wrongs of society, and consists of the conscience and the ego idol. Freud and personality structure. Id. Id is energy constantly striving to satisfy basic drives, which is based on the pleasure principle. Ego seeks to gratify the id in realistic ways, that is reality principle. And the superego, voice of conscience that focuses on how we ought to behave. Freud's theory, the id. The id uses the most primitive of thinking process. Basic biological urges, that is hunger and self-protection. The id operates on the pleasure principle, seeks pleasure and avoids pain. I want what I want now. The id operates completely at the unconscious level, no direct contact with reality. The id has two major instincts, eros and thanatos. Eros is life instinct, motivates people to focus on pleasure-seeking tendencies, and thanatos, death instinct, motivates people to use aggressive urges to destroy. The energy for its instincts comes from the libido, the energy storehouse. Freud's theory, the ego. The ego consists of a conscious faculty for perceiving and dealing intelligently with reality. The ego acts as a mediator between the id and the superego. The ego is partly conscious, deals with the demands of reality, makes rational decisions. Freud's theory, the ego. The ego serves the id, the rational part of personality that maintains contact with reality, governed by reality principle. What consequences are there to my behavior? The ego is the executive of the personality. The ego controls higher mental processes, reasoning, and problem solving. The ego uses these higher mental processes to help satisfy the urges of the id. The superego. Superego, the moral part of personality, internalized rules of parents and society. Superego is consists of two parts: conscience and ego idol, notions of right and wrong, and how we ideally like to be. Superego constrains us from gratifying every impulse, that is murder, because they are immoral and not because we might get caught. Superego, partly conscious, partly unconscious. According to Freud, an individual feelings, thoughts, and behavior as a result of the interaction of the id, the superego, and the ego. The id, the ego, and the superego are continually in conflict with one another. The conflict generates the anxiety. If the ego did not effectively handle the resulting anxiety, people would be so overwhelmed with anxiety that they would not be able to carry on with the task of everyday living. The ego tries to control anxiety, that is, to reduce anxiety through the use of ego defense mechanisms. Defense mechanism. When the inner war gets out of hand, the result is anxiety. Ego protects itself via defense mechanisms. Defense mechanisms reduce or redirect anxiety by distorting reality. So, and defense mechanism is a psychology tendency that the ego uses to help prevent people from becoming overwhelmed by any conflict and resulting anxiety. Among the id, the ego, and the superego, defense mechanisms operate at an unconscious level. We are not aware of them during the time that we are actually using them. However, we may later become aware of their previous operations and use. First is repression, pushing unacceptable and anxiety producing thoughts into the unconscious. Involves intentional forgetting, but not consciously done. Repressed material can be memories or unacceptable impulses. A rape victim cannot recall the details of the attack. Regression, acting in ways characteristic of earlier stages of personality. A young adult anxious on a trip to his parents' home sits in the corner reading comic book as he often did in grade school. Reaction formation, replacing an anxiety producing feeling with its exact opposite, typically going overboard. Repressed thoughts appear as mirror opposites. A man who is anxious about his interest in gaming being dating women several times a week. Rationalization, creating false but believable excuses to justify inappropriate behavior. Real motive for behavior is not accepted by the ego. A student cheats on an exam, explaining that cheating is legitimate on an unfair examination. Denial, claiming and believing that something which is actually true is false. A person disbelieves that she's age, asserting that I am not getting older. Displacement, redirecting emotional feelings, that is anger, to a substitute target involves directing unacceptable impulses onto a less threatening object or person. A husband, angry at the way his boss treated him, screams at his children. Instead of telling your professor what you really think of her, you tailgate and harass a slow driver on your way home from school. Projection, attributing one's own unacceptable feelings or beliefs to others, perceiving the external world in terms of one's own personal conflicts. An employee at a store, tempted to steal some merchandise, suspects that other employees are stealing. Sublimation, substitute socially acceptable behavior for unacceptable impulses. Playing video games instead of getting in a fight. So, stages of personality development. Freud's psychoanalytic theory of personality suggests that personality develops through a series of stages, each of which is associated with a major biological function. More specifically, Freud theorized that as people age, they pass through several systematic stages of psychosexual development in their personality. Psychosexual stages of development are source of unconscious conflicts. The stages of personality development involve critical events that occur in every child's life. At each level, there is a conflict between pleasure and reality. The resolution of this conflict determines personality. At any stage, a fixation can occur. If needs are either undergratified or overgratified, we become fixated at a particular stage. Each stage also involves an erogenous zone, parts of the body that involve sexual pleasures. Personality forms during the first 2 years of life, rooted in unresolved conflict of early childhood. Psychosexual stages. Oral stage 0 to 18 months, centered on the mouth. Anal stage 18 to 36 months. Focus on bowel, bladder, ileum. Phallic stage is 3 to 6 years. Focus on genitals, Oedipus complex, identification and gender identity. Latency is 6 to puberty. Sexuality is dormant. Genital is puberty on. Sexual feeling toward others. A strong conflict can fixate an individual at stages 1, 2, or 3. Oral stage. The oral stage is the first period occurring during the first year of life. Anal stage. Next comes the anal stage, lasting from approximately age 1 to age 3. Phallic stage. The phallic stage follows with interest focusing on the genitals. Latency period then follows the latency period lasting until puberty. Genital stage after puberty. People move into the genital stage, a period of mature sexuality. Oral stage of development. Time period birth to 18 months. Erogenous zone is mouth, gratification to sucking and swallowing. Oral fixation has two possible outcomes: oral receptive personality and oral aggressive personality. Preoccupied with eating, drinking, reduced attention to oral activity, eating, drinking, smoking, biting nails, passive and needy, sensitive to rejection. Oral aggressive personality, hostile and verbally abusive to others. Anal stage to development. Time period 2 to 3 years of age. Erogenous zone is the anus. Conflict surrounds toilet training. Anal fixation has two possible outcomes: anal retentive personality, stingy, compulsive, orderliness, stubborn, and perfectionistic. Anal expulsive personality, lack of self control, messy, and careless. Phallic stage of development. Time period 3 to 6 years. Erogenous zone is the genital. Self-stimulation of the genital produces pleasure at age 5 or 6. Near the end of the phallic stage, children experience the oedipal conflict, the electro conflict, a process through which they learn to identify with the same gender parent by acting as much like that parent as possible. Oedipus complex versus electro complex. Child is sexually attracted to the other sex parent and wishes to replace the same sex parent. Phallic stage of development. Oedipus complex. Oedipus complex is in this the castration anxiety. Son believes father knows about his desire for mom, fears dad will castrate him, represses desire and defensively identifies with dad. Phallic stage, electrocomplex. Panis envy. Daughter is initially attached to mom. Shift to attachment occurs when she realizes she lacks a panis. She desires dad, whom she sees as a means to obtain a panis substitute. Repress her desire for dad, incorporates the values of her mother, accepts her inherent inferiority in society. Latency period. During the latency period, little girls and little boys try to socialize only with members of their own gender. Freud posits that children do this so as to help minimize the awareness of sexuality. Thus, they continue the process of sexual repression that began in the previous stage of those who successfully made it through the Oedipus complex and Electro complex. Genital stage. When adolescents begin puberty, they enter the fifth stage of psychosexual development. They develop secondary sexual characteristics. The onset of the physical sexual characteristic reawakens people's sexual urges, and thus they are no longer able to successfully repress their sexual desire, impulses, and urges. They begin searching for a marital mate with whom they can share sex and intimacy. Summary. Freud's psychoanalytic theory has provoked a number of criticism: a lack of supportive scientific data, the theory inadequacy in making predictions, and its limitation owing to the restricted population on which it is based. Still, the theory remains popular. For instance, the neo-Freudian psychoanalytic theorists built upon Freud's work, although they placed greater emphasis on the role of the ego and paid greater attention to the social factors in determining behavior. Psychoanalysis, Freud, and personality. Slips of the tongue are likely competing nodes in memory network. Dreams may not be unconscious drives and wishes. Freud ideas as scientific theory. Theories must explain observation and offer testable hypotheses, few objective observation. Freud theory is based on his recollections and interpretation of patient free association, dreams, and slips. The tongue does not predict behavior or traits. Psychodynamic approach, humanistic trait, and social cognitive. Psychodynamic. Source of information about personality obtained from expert analysts, from people in therapy, cause of behavior, thoughts and feeling, unconscious internal conflict associated with childhood experiences, also unconscious conflicts between pleasure-seeking impulses and social restraints. Outlook on human, negative. Comprehensive of theory, very comprehensive. Many are called neo-Freudian. All place less emphasis on sex. Carl Jung. Personal versus collective unconscious, balance between introversion and extroversion. Alfred Adler, striving for superiority, motivation to master environment, notion of an inferiority complex. Karen Harney, personality is cultural rather than biological. Humanistic personality theory. Source of information about personality obtained from self-reports from the general population and people in therapy, cause of behavior, thoughts and feelings, self-concept, self-actualizing tendencies, conscious feelings about oneself. Outlook on humans, positive, comprehensive, and fairly comprehensive. The humanistic approach, Maslow's self-actualizing person and Rogers' person-centered perspective, healthy rather than sick individual as greater than the sum of test scores. Maslow and Rogers, humanistic approach, rejected Freud's pessimistic view of personality, rejected behaviorist mechanistic view, more optimistic, positive about human nature. Humans are free and basically good. Human are inner directive. Every person has a potential for healthy growth. Health growth involves actualization. Be all you can be. Given the right environmental condition, we can reach our full potential. Rogers' person-centered perspective. People are basically good with actualizing tendency. Given the right environmental condition, we will develop to our full potentials. Genuineness, acceptance, empathy. Self-concept is the central feature of personality. Humanistic personality theory, self-concept, our image or perception of ourselves, real self versus ideal self. We have a need for positive regard, approval from others, condition of birth or conditional positive regard, the conditions under which other people will approve of us. We change our behavior to obtain approval. What we need is unconditional positive regard. Anxiety signifies that we are not being true to our ideal self. Well adjusted person, self concept and experience. Poorly adjusted, self concept and experience. Maslow hierarchy of human motives. One must satisfy lower needs before one satisfy higher needs. Self This is physiological needs, safety and security, belongingness and love, esteem needs, self actualization and transcendence. Self actualization is the culmination of a lifetime of inner directed growth and improvement, challenging ourselves to the fullest. Can you identify self-actualized individual characteristic of the self-actualized person? Creative and open to new experiences, committed to a cause or a higher good, trusting and caring of others, yet not dependent, have the courage to act on their convictions. Trait personality obtained from observation of behavior and questionnaire responses from the general population as well as from people in therapy. Cause of behavior, thoughts and feelings, stable internal characteristics, some emphasize genetic basis. Outlook on humans, neutral, neither positive nor negative, not comprehensive. Trait approaches have tried to identify the most basic and relatively enduring dimensions along which people differ from one another. Dimension known as traits. How many trait dimensions are there? How can we measure these trait dimensions? Where do these trait dimensions originate? All four. Output. Most important personality traits are those that reflect our values. Output suggested that there are three kinds of traits: cardinal, central, and secondary. Cardinal, a single personality trait that directs most of a person's activities. Central, a set of major characteristics that make up the core of a person's personality. Secondary, less important personality traits that do not affect behavior as much as central and cardinal traits do. Ising. Hence, Ising found two major trait dimensions: introversion versus extroversion, neuroticism versus emotional stability. Cattle's theory of personality. Cattle trait theory distinguishes three types of traits: dynamic, ability, and temperament. Also surface trait and source traits. Cattle identifies 16 basic traits. He developed the 16 way to measure these traits. Recently, personality theorists have begun to converge on the view that there are five basic personality dimensions: emotionality versus neuroticism, calm, secure, self satisfied versus anxious, insecure, self pity, extroversion versus introversion, sociable, fun loving, affectionate versus retiring, sober, reserved, openness versus close mindedness, imaginative self, independent versus practical and conforming, agreeableness versus disagreeableness, kind, trusting, helpful versus ruthless, suspicious, uncooperative, conscientiousness versus undependable, organized, careful, disciplined versus disorganized, careless, impulsive. The Big Five theory. Emotional stability, calm, anxious, secure, insecure. Extroversion, sociable, retiring, fun loving, sober. Openness, imaginative, practical, independent, conforming. Agreeableness, soft hearted, ruthless, trusting, suspicious. Conscientiousness, organized, disorganized, careful, careless. The summary. Traits, characteristics or typical ways of acting, consistency across situations over time, distinctiveness. Each personality is unique. Explain why individual behave in a certain ways. How many traits are there and what are they? Not easy to answer, little consensus. Assessing personality trait. How can we assess traits? Personality inventory. This first is MMPI. Most widely used personality inventory assess psychological disorder, not normal traits. Empirically derived test items selected based upon how well they discriminate between groups of traits. No traits exist. The trait situation debate. Walter Mischel argued that behavior is not consistent across time or situation. If no consistency, not much pointing in arguing for personality. Thus, personality is an illusion. Situationism. Michel believed that behavior is influenced more by the situation than any internal trait. Person act situation interactionism. Both internal traits and the situation we are in are important determinants of behavior. Social cognitive approach. Mm, obtained from experiments, observation of behavior, and questionnaire responses from the general population. Cause of behavior, thoughts and feeling, reciprocal influence between people, outlook on humans, neutral, and comprehensive. Social cognitive learning perspective. Behavior learned through conditioning and observation. What we think about our situation affects our behavior, interaction of environment and intellect. Social cognitive personality theories. Bandura. Theoretical origin in behaviorism emphasizes the role of learning in personality as a classical conditioning, operant conditioning, and modeling. Instead of studying what's going on inside the person, studying what is going on outside the person. How does the environment shape personality? Social cognitive personality theories. Bandura also emphasized the importance of cognition in personality development. People develop a sense of self-efficacy, our beliefs about our ability to achieve goals. Individuals with higher self-efficacy accept greater challenges, try harder to meet challenges. Bandura also discussed the notion of reciprocal determinism. The individual and the environment continually influence one another. Personal cognitive factors, environmental factors, behavior. Internal blood world plus external world is equal to us. If you show aggressive behavior towards anyone, they also react angry. The reaction, their reaction is angry. And if you show the friendly behavior to someone, they return you the friendly interaction. Internal locus of control. You pretty much control your own destiny. External locus of control, luck, fate, and or powerful others control your destiny. Learned helplessness. Uncontrollable bad events, perceived lack of control, generalized helpless behavior. Important issues, nursing homes, prisons, and colleges. Personality assessment involves the technique for systematic gathering information about a person in order to understand and predict behavior. Goal of personality assessment to obtain reliable, valid measures of individual differences that will permit the accurate prediction of behavior. Ask the person ask the person about themselves, obtain information that reveals personality, behavior observation, watch the watch the individual's behavior in an actual or simulated situation. Personality test, objective test, and projective test. Behavioral assessment is based on the principles of learning theory. Behavioral assessment employs direct measurement of behavior to determine the characteristics related to personality. Objective personality test. Self-report questionnaire present the test taker with a number of specific items to which she is asked to respond either on paper or on a computer screen. Self-report measure asks people about a sample range of their behavior. These reports are used to infer the presence of particular personality characteristics. Examples of objective personality measure the MMPI, the 16PF and NEOPI. The most commonly used self-report measure in the Minnesota multiphasic personality inventory designed to differentiate people with specific sorts of psychological difficulties from normal individuals. Most widely used personality instrument used in clinical and employment setting. MMPI-2 has several different scales. MMPI sample items. I usually feel that life is worthwhile and interesting. I seem to hear things that other people can't hear. Major aspects of personality that if extreme suggest a problem, extreme suspiciousness may indicate paranoia. A projective personality test is one in which the subject is given an ambiguous stimulus and asked to respond spontaneously. Pictures or ink blots. No clear answer. The ambiguous stimulus allows test takers to project their own needs, dreams, feelings into their response. The observer's response to the stimulus are then used to infer information about the observer's personality. All projective tests are based on the projective hypothesis, which states that the individuals respond to an ambiguous stimulus which presents a projection of his or her own inner, often unconscious feelings and needs. Indirect method of personality assessment based on psychoanalytic assumption, personality is mostly unconscious. People are unaware of contents of unconscious. The two most frequently used projective tests, Rorschach and thematic apperception test. Rorschach, most popular projective technique, respond to input. What could this be? Thank you.